NHS Test and Trace is a big part, not the only part, but a big part of the answer to that question. NHS Test and Trace means we can start to replace the national lockdown with individual isolation for those who've been in contact with the virus and local action where it's necessary to respond to a flare-up. The concept is simple. First, through testing, we hunt down the virus, finding out who is infected right now. And I use we very deliberately because we all have our part to play. This is a national effort and we all have a role. If you have symptoms, you must isolate immediately and get yourself a test. Yesterday, 2013 people tested positive, and the next step is that through contact tracing, like detectives, the NHS clinician from NHS Test and Trace and the person who's tested positive work together to identify the possible movements of the virus, where it's been, and who else it might have infected. Then we isolate those contacts who might have been infected so the virus is unable to spread and we break the chain of transmission. Think of it like this. The virus exists only to reproduce. That is its sole biological purpose, to make as many copies of itself as possible. If we can thwart that purpose, we can control the virus and ultimately defeat it. We must all follow the NHS Test and Trace instructions because this is how we control the virus and protect the NHS and save lives. And of course, testing capacity is critical to making this work. We now have the capacity for 161,000 tests a day. And because of that increased capacity, I can announce that we're expanding eligibility yet further. From tomorrow, we're expanding eligibility for testing to include the under 5s, so that now every single person who has symptoms of coronavirus can get a test, no matter their age. And what's more, to make NHS Test and Trace as effective as possible, it is very important that everyone with symptoms must isolate immediately and go and get a test.